KPOA 93.5, Aloha Morning Show, 721. And as we do every Thursday morning, want to welcome to the show our health professionals from Maui Health. We have Rehab Supervisor from Kula Hospital. I want to say good morning to Taylor Smith. Good morning, Taylor.
Good morning, Shane.
Hi, Taylor. A couple of questions this morning. What role do physical, occupational, and speech therapy play in helping Kula Hospital patients and residents regain independence?
Oh, yeah, good question. So we all do a little bit different. I'll start with physical therapy, also known as PT. They help with strengthening, balance, endurance, transfers, and of course, ambulation. The primary goal is to focus on regaining independence, needed for getting out of bed, transfers to a wheelchair, or ambulating with a device like a walker or a cane. And then occupational therapists, which shout out to the other OTs because that's actually what I am.
Oh, awesome.
We focus on independence with ADLs, which is activities of daily living. That's your dressing, bathing, toileting, kind of meal prep. And then speech therapy, they specialize in improving language, speech, communication skills, along with treating individuals that might have difficulty swallowing. And so that's kind of what we do as a role for each discipline within the hospital.
Got it. Taylor, what is short-term rehab at Kula Hospital?
Yeah, so short-term rehab is what we call our swing unit. This is kind of an individual or an in-between facility for patients that no longer need acute care like Mount Memorial. They're medically stable. However, they're not at a point where they can go home and be independent or return home. So they come to us with the ultimate goal to return to the community, to be as independent as possible, whatever that kind of looked like previously. And then some of the common illnesses and injuries that we do treat under short-term rehab is, someone had a stroke, a heart attack, a lot of orthopedic injuries after a fall or an accident. We also see some complex medical and neurological injuries too. The really good thing about Kula Hospital is that we also have a skilled wound team led by our physician and nursing unit to heal complex wounds using IV or a wound vac or things like that.
Nice. And we want to thank you guys, Taylor, for all of that great service you guys provide to our residents and patients at Kula Hospital. Now, long-term, Taylor, what does the rehab department do for residents who need long-term care at Kula Hospital?
Yeah, that's a good question because a lot of people don't necessarily think that, you're going to see a therapist in the long-term care unit. So for residents, our kūpuna that need to be at Kula Hospital for long-term care, the rehab team works really closely with them. Our focus is maintaining kind of their current level of mobility and independence. Kind of everyone looks a little bit different with that. And so what we've developed is this program called MEP, which stands for Maintenance Exercise Program. It's designed by the therapist with the residents, so everyone's one-to-one. We kind of work on a program that they want to work on for preventative decline, whether that's mobility, range of motion of their arms and their legs, strengthening. Most of our residents, they love coming to the rehab gym to work out. It's also beneficial because the therapists are seeing the residents, working with the rehab aides. So if they do have a decline, we can step in right away and kind of either prevent that decline. It's similar to a community member going to an outpatient therapy unit, except for us, we have the ability to treat them right here in their home at Kula Hospital.
Awesome. And again, Taylor, we thank all of you for your endless work for all of our kūpuna and those who are residents and patients there at Kula Hospital. Taylor, thank you for calling us this morning, and I look forward to talking with you again.
Oh, thank you so much. And then if anybody wants to learn more, you can always visit mauihealth.org/Kula Hospital.
Awesome. See you, Taylor. Have a great day. Aloha.
All right. Thank you, Shane. Aloha.